intensive care, both requiring ventilation. Yesterday, 2,675 tests were conducted across the territory. That's higher than the previous days, but still a little lower than we would like. So again, if you have any symptoms, please come forward for testing straight away. Too many of our cases have been waiting days and days with symptoms before coming forward to get tested. That's why they've been infectious in the community for an extended period of time. And this would be one of the ongoing challenges of getting the number of infectious people in the community down, is the delay and the time that people are taking to come forward for testing when they've obviously got symptoms. So please, if you have any symptoms, you've got to come forward for testing. Compliance activities continue across the territory and at our borders. The Australian Defence Force are now working with ACT Police and New South Wales Police at ACT border checkpoints. Over 2,000 traffic stops were conducted yesterday. In very simple terms, you should not be moving across the ACT New South Wales border unless you have an essential reason for travel. Now's not the time to be going for a trip into New South Wales. Yesterday, over 3,000 first doses were administered at ACT government mass vaccination clinics. We're still at the point of the vaccination rollout where first doses are the majority of our daily vaccinations. There are tens of thousands of unvaccinated people still in the ACT. They are mostly younger Canberrans who have bookings but are still waiting to get their first dose of a vaccine. At this point, less than 1/3 of Canberrans aged 16 to 39 are fully vaccinated, whereas if the population aged 40 plus are now over 80% fully vaccinated. Can report that the Moderna vaccine has arrived and is available in significant quantity at local pharmacies. It's available right now for people who aren't vaccinated. Canberrans aged 12 to 59 are eligible to receive the Moderna vaccine. So if you jump online now, you may be able to get a Moderna booking today. Pharmacies right across the ACT have access to the Moderna vaccine, and there are bookings available. So jump online. You may be able to get your vaccine in the next few days if you can't get it today. Jump online, make a booking. We need you to get vaccinated. Today, ACT Minister for Skills, Chris Steele, and I announced a significant extension to the Job Trainer program in the ACT. This expansion will see around 2,500 additional free training places available. The Job Trainer extension will support a mix of full qualifications and short courses, with 575 training places reserved for aged care and 170 reserved for digital skills. The new funding will also support Canberrans who struggle to find a job, including those who've been out of work for an extended period. And it does this through providing places in pre-employment, pre-apprenticeship and foundation skills programs. The first of these new free training places will be available before the end of this current calendar year that will support ACT school leavers. Now, importantly, as we emerge from our lockdown, in partnership with the ACT government and the Australian government, so a joint initiative between the two, we're providing free training and short courses through the Infection Control Training Program. This is to assist local businesses to keep their workers and customers safe. The program will support our city's safe and gradual reopening by giving workers in industries including retail, hospitality and personal services access to nationally accredited training on how to operate in a COVID-safe way. The expanded Job Trainer program and our continued investment in skills are an important part of meeting emerging workforce challenges as we emerge from the pandemic. These free training places are a huge opportunity to reopen our economy in a COVID-safe way and for individuals to get the skills they need to build a successful career in many different industries. Now, before I sign off today, it's the International Day of Sign Languages, and I'd like to take the opportunity to thank Cherie and Lauren, who are here today, and also Mandy for being with us every day and providing vital support to our deaf community. Thank you. In summary, for those who've joined late, we've recorded 16 new cases, which is pretty much in line with the 7-day rolling average for cases in the Territory. 7 of them are linked and are household contacts predominantly. We know at least 11 spent part of their time infectious in the community. We have 12 people hospitalised, including patients from New South Wales, a trend that will continue into the future. And we have 2 people in intensive care, and we send our love and support to their families. Deputy Chief Health Officer Dr Vanessa Johnston will provide an update on the overnight cases and epidemiology, and Minister for Health Rachel Stephen-Smith will provide a health update, and following that all 3 of us will be available for questions. Thank you.
Good morning. I'm Dr Vanessa Johnston, the Deputy Chief Health Officer of the ACT. So the total cases for this outbreak now stands at 674, with 16 new COVID-19 cases notified since our last update. We continue to see people recovering, which is great news, and our total number of recovered cases now stands at 463. That's 27 more than yesterday. So we're continuing to manage 211 active cases. Of the new cases today, I can confirm that of the 16, 7 are linked to cases and ongoing clusters. Indeed, 7 of them are household contacts. The remaining 9 still are under investigation as to the source of their infection. Of the 16, none of these, unfortunately, were in quarantine for their entire infectious period. 5 remain under investigation, so we're still acquiring further information from them. 4 were essential workers who were infectious in the community for a period of time, and 7 spent various degrees of time infectious in community. And we're still working through our contact tracing process to understand the public exposure locations for these people. So it's important to remember that the time that people spend infectious in community varies, and the risk of that varies also by the nature of their activities and whether they're wearing a mask and other factors. So as I've said previously, we do take a particularly conservative approach on this factor as we continue to strive to work towards our vaccination goals. So to 8 o'clock last night, there were 12 people that were in hospital. 2 of these are in ICU and are ventilated. So of the total 12, 6 are unvaccinated, 3 have received 1 dose. 1 is fully vaccinated, and that does not account for the people in ICU, and 2 are unknown. So of the total 12 in hospital, our youngest patient remains under 12 today, and the oldest is in their 90s. We now have over 950 self-identified close contacts and over 450 exposure locations. Today, we do have additional medical centres and pharmacies that are being added to our daily exposure lists. So as these are essential locations, and that we still have people moving around in the community to access these essential sites, there's always a possibility that someone is unknowingly infectious while attending one of these sites. So this is the same as when we see supermarkets on the list due to people going out for the approved reason, and that is for collecting essential supplies. So it's not surprising. I think the important thing to remind everyone, again, is when we're moving out and about in the community for those essential reasons that we can leave home, that it's so important that we wear our mask correctly. So we'll always have one, wear it correctly, maintain your social distance, check in with Check in Canberra, and keep checking into our website and your Check in Canberra app to make sure that you haven't been at one of those locations that's been listed as an exposure site. As the Chief Minister said, we need to remind the community to please get tested immediately once you get symptoms. If you have any symptoms at all, and they might be the mildest of symptoms, a runny nose, a slightly sore throat, and go straight to the testing facility and straight home. Don't pop into the shop for groceries. Don't go through the driveway on the way home or to the testing facility. And always, please continue to keep up to date with those exposure locations on the COVID-19 website. We're now down to 2 active public sites of transmission with the removal of Bidfood Canberra today. So this now only leaves Busy Bees Childcare Centre in Brindabella and Ainslie Village. So as the Chief Minister said, this is the International Day of Sign Languages, and we have already done a shout out to our amazing Auslan interpreters who are here with us every day. But it's really appropriate once again for us to express our appreciation to this wonderful team, all that they do for us and our deaf community here in the ACT. So to Lauren, to Cherie, to Mandy, so thank you.
Good afternoon. I also want to thank Lauren, Cherie and Mandy for the work that they do interpreting for us every day. It is absolutely invaluable to our deaf community, and what a great day to celebrate their contribution. I just wanted to provide a quick update on the health workforce situation. We've talked about this a few times throughout this outbreak. So I'm pleased to report that our health workforce is now in a really strong position. We've completed additional recruitment to boost our pandemic response through a call out for nurses and other health professionals. To date, the team has received more than 1,500 applications from people keen to join Canberra Health Services. Almost 600 of those applicants have come on board so far, with another 40 nurses coming on over the next week. We'll use the remaining application list to fill any casual vacancies that arise, in line with our hospital surge requirements in the months ahead, should that be necessary. And in further good news, there are now fewer than 50 staff across Canberra Health Services and Calvary Public Hospital who are unable to work due to being in isolation or quarantine. So obviously that's a significant improvement from what we were seeing a few weeks ago when we had so many Canberrans in quarantine. I just wanted to provide a quick update and reminder that Western Creek Walk-In Centre, co-located at the Western Creek Community Health Centre, has now returned to its usual health service operations. And when I say usual, I think it was open for about 3 months before it became a testing clinic. But it has now returned to being a walk-in centre, available to treat non-life-threatening situations, including minor infections, sprains and fractures, cuts and wounds, and bites and stings. So a good alternative to the emergency department for those people with minor injuries and illnesses, particularly in Western Creek, Molonglo and Woden areas. An ACT pathology clinic is also opening at the walk-in collection centre, is now open at Western Creek Community Health Centre, providing another health service for people in Western Creek, Woden and the Molonglo Valley area. The collection centre provides access to important blood tests and routine pathology work, which are vital to meet the medical needs of patients, especially those with chronic conditions who need to have these as regular checks. So the collection centre has 2 rooms and is open Monday to Friday from 8 a.m. to 4 p.m. No appointments are needed for pathology services provided at the centre. Finally, I just wanted to note that as the current outbreak spreads across the ACT, we have seen COVID exposure at our health facilities, and this is to be expected as more positive cases require care and interact with our health services. I'd like to assure the community that ACT health facilities have extensive COVID management plans in place to minimise the risk to staff and to those who are receiving care. This includes identifying and contacting impacted staff or patients and deep cleaning affected areas. Frontline staff wear full PPE at all times while interacting with patients, including face shields and masks. And there is a high level of vaccination across our frontline health staff, and particularly in COVID wards. Anybody working with known COVID-19 positive patients or highly likely COVID-19 positive patients is fully vaccinated or has had a conversation with their manager, and that situation is being managed. And anybody working on a COVID ward is also fully vaccinated. So I'd like to finish by acknowledging and thanking all of our health staff, as we do on a regular basis, who are providing professional, skilled and compassionate care for people with COVID-19 or suspected of having COVID-19, as they do every day for patients who are in hospital for a wide range of conditions. And with that, I'll hand back to the Chief Minister. Thank you.
Thank you, Rachel. Any questions?
Chief Minister, Lieutenant General John Fruin declared earlier this month that Australia's vaccine supply issues are over. Was that a little premature? Are you concerned about the ongoing consistency of Pfizer supply for the ACT, particularly this coming month?
Well, look, we would have preferred to have greater certainty coming into October. We hope we will get that sooner rather than later.
We've heard of a GP in Queanbeyan had a clinic this weekend coming that had to be cancelled because of supply issues for Pfizer. Have we seen similar things happen in the ACT, and is there anything that the government can do to assist those patients?
I have heard anecdotal reports of this issue emerging across the primary healthcare network. Anything the ACT government can do, no, because we don't control the vaccine supplies. We're experiencing the same challenges as GPs and pharmacists, although I am aware that Moderna has arrived, as I mentioned in my opening remarks. And when I jumped online this morning to see how widely and how many appointments were available, there was quite a few, including today.
Will existing appointments at government clinics likely need to be moved around, reshuffled?
No. So we've been very conservative with our approach, ensuring that we would never cancel anyone's booking because we didn't have vaccines available. But what the uncertainty does is make it difficult for us to open up new bookings earlier. I would really like as many people as possible to be vaccinated in the coming weeks. And what's holding that back, as has been a challenge, week on week, month on month, since the vaccine started arriving, is that demand outstrips supply.
Minister, other states are continuing to outline their reopening plans. Victoria announced yesterday a plan for reopening schools, vaccinating teachers. Why haven't you done that yet? Do you have a plan yet, or are you still in the works of that? And what's your justification for not telling us what the plan is at this stage?
So we've indicated we will have fortnightly checkpoints in relation to our current circumstance, and then to provide information on what the next fortnight would look like, and then what would happen beyond that. We released our pathway forward more than a week ago, and we'll further update the community next week.
So you have that plan, but you're going to update the community next week as opposed to now?
We have a pathway forward, and we said we would provide the further detail that people consider necessary to label it a roadmap as opposed to a pathway. There's some sort of curious naming that goes on in the media. So I don't know who you are, sorry. You've never been to a press conference before that I'm aware of. So if you had,
I mean, roadmap or pathway, it's the same
Yeah,
thing
and we released
essentially,
it. We
anyway.
released the framework last week and said in 2 weeks' time we would update with further detail. This was the question I was asked yesterday and the day before, and I repeat the answer I've given. Next week.
We know, or you've just mentioned, how urgent the vaccine rollout is. Pharmacies sort of had been anticipating that Moderna supply to arrive earlier this week. It, landed in Australia on the 18th. It's now been sort of 5 days. Is there any way that we could get these supplies more urgently, given, each day is of the essence?
I don't know. You need to ask General Fruin and the Operation COVID Shield team.
Could we put any more pressure on or, request?
Well, I would argue that I have been day on day, week on week, month on month, been on the case on this, and the ACT has the most efficient vaccination program in the nation, as evidenced by the Commonwealth's own reporting. And it's us, and then quite a gap to the next most efficient program in the nation being run by the West Australian government.
Is it frustrating then that we're not getting these doses sort of on time?
Enormously, yes.
Chief Minister, in terms of what you're planning to outline next week in terms of social restrictions, there is some concern in the community about lack of clarity about what is being complicated. Can you confirm that there will be some easing of social restrictions and people will be in some degree able to move around the community more freely, or are you not willing to share what the government is contemplating at the moment?
Yeah. So, as outlined in last week's pathway forward, the preferred pathway is a gradual easing of restrictions as we move through vaccination thresholds. That means moving from the highest public health social measures that have been in place. We've eased them twice now already, easing through high to medium, then to low, and then to baseline. As outlined in the National Plan, you would see the detail of what high, medium, low and baseline looks like in the Doherty Institute modelling, and we outlined that in the pathway forward last week. So yes, all things being equal, we're not seeing any concerning further outbreaks. So the usual caveats, the same as New South Wales and Victoria in terms of caveats. It is our plan and our objective to gradually ease restrictions. We do so in a 2-week cycle, and we tend to provide advice 5 to 7 days ahead of an easing in order to give people time and notice, particularly for business, to adjust to that next step in the pathway forward.
So what would be some of the specifics that are contemplated in the next step?
Moving from high towards medium over the period between now and when we would come out of lockdown and then beyond. We would be at the bottom end of high, moving into medium through the first 2 weeks of October beyond the current lockdown schedule, with more happening post 15 October than post 1 October.
Okay, thank you. What are some of the activities in medium that people might be
Well, I'm not making next week's announcement today. I've indicated the process, the rationale that we released last week. Now, I don't know you either, sorry. So people who turn up randomly to a press conference and may not have followed the detail of this, it is quite frustrating for everyone watching because we have covered this multiple times.
I was just after some extra detail about what would be coming forward.
And we've provided that.
Or why that isn't being announced.
And I'll provide more next week. Thank you. Yes.
Chief Minister, with Moderna arriving and plenty of AstraZeneca at pharmacies, and with the hiccup in Pfizer supply, and there being a bit of a lag time between booking and actual getting your shot, would your recommendation be now for people to check out their local pharmacy rather than book at a mass vaccination clinic?
Well, it would depend on their circumstances, Ian, their age group, and whether they've already got a preferred pathway for vaccination. So there's a lot of people who have bookings in our system for the AIS mass vaccination clinic, and just looking at the data there, we've got available appointments on the 11th of October is the next earliest date there. So it may be that people who are booked in for those first couple of weeks in October might find they could get a Moderna vaccination from a pharmacy today or this week. That would be a quicker pathway to obviously getting first dose protection, but also to get their second shot, noting that Moderna has a 4-week dosing interval as opposed to Pfizer's 3-week. So it would depend on the individual circumstances.
But that pathway would accelerate
it would,
the
yes.
uptake of
Yes.
vaccination.
And so what we want to see is more people get vaccinated more quickly, because regardless of which model you believe in, which model you've read, there is no doubt that the more people who are vaccinated, the fewer number of cases, the fewer number of hospitalisations, and the fewer number of people in intensive care. The more vaccinated the community is, the safer it is. And what we would like to see is as many people vaccinated as possible, as quickly as possible, so that we can come out of our lockdown and ease our restrictions and do so in the safest possible way, noting that nothing is safe with COVID. But what I am determined to see is as many people have the opportunity to get vaccinated as possible, and I'll fight hard for this jurisdiction to get access to the vaccines that are necessary to achieve that goal. I want the ACT to have the highest vaccination rate in the nation, and I believe we will. I strongly believe that we need to allow 12 to 15-year-olds the opportunity to get vaccinated, and we're not making rash decisions that will leave that section of the community at risk. We've also got to vaccinate the parents of primary school age kids, and we're well advanced on that, but there's still more to do. So my objective is highest possible level of vaccination, lowest possible level of new cases, even lower level of hospitalisation, and preferably no deaths. I do not want to stand at this podium and give glib, this many people died today, like some of my other colleagues have to. It's just distressing for everyone. And we can do better, and we can vaccinate our community. And maybe I've been criticised, and we've got a couple of journalists here who are running that line, but maybe I just have a higher value on human life and protecting people. I'll plead guilty to that.
Do you have the latest projections on our vaccination rates hitting the 70 or 80% threshold? Is that changing day by day?
Yeah, it does, because of vaccine supply issues. I mean, we could have got there a lot quicker months ago if it had been a race from the start. And we have the most efficient program in the nation in getting vaccines into people's arms. The most efficient by a long way. 99.8% of doses available at the last checkpoint in people's arms. Far and away the most efficient program. We want to keep on delivering it to get more people vaccinated.
Chief Minister, you've spoken previously about what you see as perhaps the important role that rapid antigen testing will play going forward. Would you support the use of those in the home?
Yes, I don't see why not. More people who can access rapid testing, particularly those who are fully vaccinated, who are likely to be asymptomatic. Yes, I think it helps. Obviously, there's an approval process that various regulators have to go through, but I understand there's lots of products on the market. Everyone acknowledges that rapid antigen tests are not as precise as the PCR testing, but they do produce a result quicker, and if they produce a positive result quicker and get someone who would otherwise be infectious in the community quarantined, then that would be a great outcome for everyone.
Is there particular industries you'd like to see them used in?
Look, I don't think that really matters. I just want to see them used more broadly.
We heard from the Health Minister about the vaccination rate among the health workforce. The disability sector has been a concern throughout this outbreak as well. Is the government considering mandating vaccines for disability workers? And if not, why not?
So this matter has been before National Cabinet. National Cabinet sought advice from AHPPC. We were told that advice would be back by the end of September, so presumably it's coming to the 1 October National Cabinet meeting, and it would be considered by all jurisdictions at that point.
What's your view?
I'll need to see the AHPPC advice.
Chief Minister, yesterday Victoria announced their plan for reopening schools, talking about mandatory vaccines for teachers, filters in classrooms. Obviously there's an important focus on vaccinating the children that can be vaccinated and their parents, but what kind of planning is underway to get schools in the Territory reopened, and when do you see that happening?
Extensive planning, and I'll announce that next week.
So you're going to announce the plan for opening schools next week?
Yes. Yes. I've already foreshadowed all of this a week ago.
Has
yes.
the ACT government entered into any discussions with manufacturers, providers of rapid antigen tests in order to secure a supply when they may be needed in the community here?
That's principally going to be a Commonwealth government matter. It might be delivered jointly, but at this point we will obviously need approval from the various regulatory authorities in relation to those tests and which ones would be certified as being suitable.
You spoke yesterday about the growing challenge of getting people who are fully vaccinated and potentially asymptomatic into quarantine. In the early stages of this outbreak in the ACT, we quickly saw 20,000 Canberrans in quarantine, which had an impact on the essential workforce in the Territory. How will that be balanced as restrictions are eased when we could potentially see more than 20,000 people in quarantine? Will quarantine requirements have to change to acknowledge that?
It's a good question, and one that, again, we're waiting to receive further advice from AHPPC. It was on the National Cabinet agenda at the last meeting. We received some initial advice that they were going to be preparing advice and that there would be a need to look at the totality of test, trace, isolate and quarantine in a more fully vaccinated community in a post-strong or high or medium public health social measure environment that you would anticipate moving into at that phase. A lot of the modelling talks about optimal TTIQ. I don't think anyone is going to get to that point because case numbers will just be so high. And there'll be so many asymptomatic transmitters of the virus who are fully vaccinated. So I have highlighted, as your question covers, what I suspect is going to be a big challenge, that people who are fully vaccinated think that's it, I don't have to do anything else, I have no other obligations now, I'm vaccinated, and will ignore the possibility that they can contract the virus and spread it potentially to thousands of other people. And in an environment where we are all mixing again in ways that we used to do, then there will be super spreader fully vaccinated individuals. So you're still going to have some form of quarantine or self-isolation arrangements. I observed probably a couple of weeks ago now that there's at least a few pharmaceutical manufacturers who are going to need to change their advertising slogans. We do not want people soldiering on when they are unwell, whether it's the flu or COVID, any symptoms, and you're contagious, you've got to stay at home, even if you're vaccinated.
Has the ACT government modelled at all what the impact of having 50,000, 60,000 Canberrans in quarantine could look like economically, socially?
Well, I think we've seen what having 20,000 looks like, so we have a lived experience of that. So presumably, if it were 50 or 60,000 people, then multiply that and assume a random collection of 60,000 people would cover pretty much every area of economic activity across workforces, both public and private sector, quite a challenging environment, would impact on schooling, would impact on health service delivery, would impact right across the economy. Very challenging.
Chief Minister, you've spoken about your frustration around compliance, particularly in the construction sector. You were saying that some sites will need to be shut down now rather than just being warned. Should more fines be being issued than warnings at this point as well?
Well, I think the ultimate sanction on that small number of residential construction sites that were found to just be completely ignoring the rules was just complete shutdown. Like, for some businesses, a fine is but a slap on the wrist. The ultimate sanction is just to shut down unsafe operations. But look, when it comes to residential construction, most of the sector, particularly those who are members of the HIA or the MBA, do the right thing. But there are some in that sector who don't just think public health restrictions and responding to COVID isn't optional. They think all workplace health and safety matters are optional, all industrial relations matters are optional. There are some people who think they can just operate outside of the law entirely. Those operators are shut down, and they should be.
You've spoken previously about the staffing pressures with the Garran Surge Centre to equip that for COVID-19 patients, should that be required. The original deed of agreement with Aspen Medical says that the ACT needs to give Aspen 3 weeks' notice for them to be able to increase their own clinical staff. Has that 3-week notice period been given? And if not, is the ACT government considering giving that notice period?
Well, it hasn't been given yet, as far as I'm aware, and I wouldn't have thought so at this point, given where we are in terms of our lockdown and our case numbers.
I have some questions for the Chief Health Officer if my colleagues are finished with the Chief Minister.
Terrific. Thank you.
Thank you. Doctor, is there a COVID case in a medium-density public housing complex in Canberra's inner north and another beyond the ones we've previously heard about at Ainslie Village and as well as on Northbourne?
So obviously there are COVID cases right across the community. And we do have cases in other sites that are occupied by ACT public housing sites. So at the moment, though, we're not seeing the kind of transmission or the level of transmission that we were seeing in Ainslie Village.
Okay, so is there a case at Reed Court at the moment?
Reed Court? I'm not aware of a case at Reed Court. I'm aware that there's testing being done there today, but I'm not aware of a case at Reed Court.
I probably have the same information. Can you confirm that there have been 6 cases at Windaya Court in Watson and that Cossington Gardens in North Lynham is also another site?
There are a number of cases or several cases, I'm not sure of the exact number, that have some association with Windaya Court. They're not necessarily resident there, that we're investigating at the moment. Cossington Gardens, I'm unaware of. So I guess this is just to reflect the fact that there are cases across the entire community, including many, apartment blocks, townhouses, public housing sites.
But is information being kept on a need-to-know basis, and staff and tenants being advised of any of these cases?
So when we become aware that there is the potential for transmission at that site, or we indicate, or our analysis indicates that there is transmission, then there's certainly wider communication that goes out to whether there are any staff on site or residents at that particular point in time. Otherwise, if we have individual or a small number of cases that are not connected, then those individuals are afforded the privacy that the rest of the community are.
Could you please tell us the percentage of healthcare workers who are vaccinated, either first dose and second dose? And does that number, are you counting as well the cleaners and cooks and those sorts of people who work within the hospital and other healthcare settings?
Yeah, I think on that question around healthcare workers, Canberra Health Services is best to answer, although I'm sure the Minister for Health would have something to say about that too. I know that the numbers that have been surveyed are very high, but I don't have the latest data, so I might defer that to the Health Minister.
Those cases at Windia Court, when were they sort of first identified? And yeah, I guess how many, is it like a handful? Do you have a rough estimate of how many we've seen? And are they linked?
So at this point in time, I can't give you the exact date of first notification, but at this point in time, some of them are cases within a household, so as we'd anticipate with any other household, so are linked by virtue of that. And we're still investigating other linkages, but to this date, we're not convinced that there's transmission at that site.
And any of those in today's numbers?
No, not to 24 hours to 8 o'clock last night.
Just in terms of what we've been learning about mental health impacts throughout the lockdown period specifically, is what role on mental health impacts does uncertainty on the pathway out play, and is it an urgent matter from a medical point of view? Is it urgent to try to map out with as much information as possible what the future weeks and also months might look like?
Yeah, I think it's appropriate to highlight the role that uncertainty at a wider level plays on all of us, and I mean that level of uncertainty has been hanging over our heads now for 18 months. And that's not necessarily also going to be resolved with the roadmap or the pathway forward, because Australia, is in for a new experience moving from elimination to community suppression, something that we haven't experienced before. So I think there is understandably a lot of anxiety about that. But, I acknowledge that the community is really keen to have more information, more specific information about the pathway forward. It's just really critical that we get that right, and that is most fully informed as we can. We note that New South Wales and Victoria have come out with roadmaps, some of which are very heavily caveated, and I'm not saying ours won't be either because of the ongoing uncertainty. But they've also been experiencing their lockdowns, or in the case of Victoria, multiple lockdowns over a much longer period of time. So we just have to balance our own experiences here in the most recent weeks that we've been in lockdown. And as the Chief Minister has indicated, there will be more to say next week that will give some of that, or as much certainty as we can expect from a document such as that.
Are you in a position to say how many children under the age of 12 are currently in hospital, and whether they're there due to the severity of their disease and symptoms of COVID-19, or because their parents are unwell and no one's there to look after them?
My understanding is there's just one child there under the age of 12 at the moment, and they're not there for the severity of their disease. It's a social issue in that they don't have the appropriate care at home.
Can you tell us how many people from New South Wales are in Canberra hospitals?
My understanding, based on the data that I gave you to 8 o'clock last night, was 2. Thank you.
Yeah.